today, like we talked about, I want to get your insight as a doctor of physical therapy on pelvic health, pelvic stability. I'll start off by introducing myself to our audience. So I'm Stacey Kasianchuk. I'm a Gennev menopause coach, and I'm also a registered dietitian nutritionist with expertise in sports nutrition and exercise physiology. So with this topic, I'll start off by saying I have I'll call it a somewhat understanding of pelvic health. I know it's important from my anatomy and physiology classes and previous life as a group exercise instructor and personal trainer. I'm familiar with that musculature, but I know now that there's been a lot more research and a lot more targeted approaches for pelvic health and stability. So I'd love for you to just introduce yourself, your role as a doctor of physical therapy, maybe give some insight into what that is in case some of our audience members are not sure of it. And then what is your role specifically in supporting women's health?
All right. Thank you. My name is Meagan Peeters-Gebler, and I am a doctor of physical therapy, as well as a postpartum and pregnancy corrective exercise specialist and a certified strength and conditioning specialist. So, as a doctor of physical therapy, our introductory education is pretty general into the field of women's health and pelvic health. So most of us who go on to pursue this specific area of study, it's kind of postgraduate work and continuing education to acquire those skills and knowledge. And it is basically looking at the pelvis as a part of the whole, right? So, kind of as general PTs, we often look over the fact that it's muscles, tendons, ligaments, nerves, bones. It is made up of exactly the same stuff that our necks and our backs and our shoulders are. And just making sure that we recognize its important role in the musculoskeletal system for pain and, like you alluded to, like lumbopelvic stability, but then also for continence or keeping our urine and stool in, and then sexuality. So kind of putting all those pieces together and figuring out how mechanically, as PTs, we can promote better overall health and function to those areas.
Excellent. That's a great overview and gives us some good things to talk about and to dive deeper in. I would say, so as an exercise physiologist and, like I said, previous personal trainer and someone that also tries to make exercise a part of my life, in a way, honestly, my goals really are to stay healthy and to have longevity, and understanding learning more about the importance of musculature all over our body and pelvic health has really, as I've been in this field a little bit longer, learning more about that. So my general understanding is that the pelvic floor, as you plays a role in obviously continence and making sure that urine and stool do stay where they're supposed to be until we actually move them out
Yeah.
on our own planning
Yeah.
versus not. And then also from a core stabilization, I mean, the pelvis is really close to the low back. It's the connection to a lower body. So I've had an understanding that strength in that area can also be important for decreasing risk of injury in other areas of the body. I would love for you to just dive into that. Correct me
Okay.
if I'm wrong on
Yeah.
some things. And, let's clarify some of this for our
Yeah.
listeners.
Definitely. So I always like to point out that, research has shown that disorders with continence and breathing actually have a higher correlation to low back pain than
Hmm.
obesity or inactivity.
Wow,
And I
really?
think, yeah. So I think that is kind of a profound, way of really recognizing the importance of the pelvic floor, but then also the respiratory diaphragm as it relates to the pelvic floor in kind of a systemic container pressure management system, right? So
Okay.
we know that the pelvic floor, yes, is kind of a hammock of muscles that
Hmm.
slings across the bottom of the pelvis. Um,
Ah,
Ta-da.
visuals.
Yeah. Yeah. So it's there. It attaches to, the entire pelvis. It attaches to the tailbone and the sacrum. And it really does span and serve as like a struts and a structure to that the whole bottom opening of our body. And if there's either weakness or in coordination, there is going to be an inherent vulnerability to everything that is stacked on top of that.
It's
So,
such a good point.
yeah.
And is it possible? I guess what I notice a lot with a lot of the clients I work with through the Health Fix program is that all of a sudden during menopause, things are just happening all over the place, and they start to notice things that they may have not noticed before. So, related to pelvic health, maybe all of a sudden there is more incontinence, or they're really wanting to improve sexual function or get their sexual function back. Is it possible, you know, over time, because that someone may not be aware of this, we may not be working on supporting our pelvic health, then menopause hits with all these other things, and it's accumulation of not supporting pelvic stability for years that happens at this point? Or is it really something that during menopause, the decrease in estrogen and what's going on during menopause affects?
Yeah, I almost, so clinically, I see it almost as like the straw that breaks the camel's back, right?
Hmm.
So, gravity and bad habits and posture and life have been accumulating insult on these poor structures. We also know that the vast majority of women who are verbally taught Kegels are doing them wrong.
Oh,
So, it's almost like, yes, we've been exposed to all of these challenges. If we're even working on it, chances are we're working on them incorrectly or even in a detrimental way. But then once menopause comes along, you're right, like blood flow changes,
hmm,
weight changes, and that definitely sets those pelvic floor muscles up for a disadvantage. I always describe to my patients, without estrogen and without that good blood flow, suddenly these healthy, plump muscles
hmm.
get thin and fragile and weak, and just the structural integrity automatically diminishes if you do nothing else besides ride it out.
Okay.
So wanting to either prepare before,
Yeah.
be actively engaged during, and figure out continued maintenance from a PT perspective, I think is huge to navigate that time.
Yeah. And I would say some of the questions that I get from a lot of the clients I work with, a lot of them are having back pain or knee pain, are
Mhm.
some things there. And I often recommend that they do exercises with a physical therapist, go to see a physical therapist to make sure that they're doing exercises correctly. And you bring up the good point about the Kegels, that most people are doing them wrong. So, can you talk a little bit about what you see as maybe some challenges for women, and then how you address that, and maybe give us some instructions on what is the correct way to do Kegels,
Yeah.
if that's possible over a podcast?
Right. Yeah, definitely. So, I think what we encounter typically in the clinic is that kind of two diverging paths. One
Hmm.
is that women are either squeezing with all their might, kind of everything between their ears and their eyebrows, and their knees and their toes, like everything is gripping, and that it's just too much that they end up actually generating too much pressure and making their pelvic floor have to work too hard.
Oh, interesting.
Um, and on the flip side, it's that there's absolutely no connection. It's like pelvic floor. What
Hmm.
is that? My anus? Is that my? Like how do I even feel that? Like I don't feel anything moving. So it's that women are either excessively connected or totally disconnected to
Okay.
those parts of the body. Usually what we do is we kind of take the approach of helping them find those body parts at the base of their pelvis through the breath.
Okay.
Because when we use the breath, what we can do is we end up um, tapping into some of the automatic reflexes and just exploiting the physics of how pressure moves through your body as a container to help them hone in on exactly what parts they should be feeling, in which direction, and to what extent.
Oh, interesting. Is that something you could even direct me through right now over
Mhm,
the
definitely.
over the podcast? I'll give it a try. I'll let
Right.
you know what I'm feeling
Okay.
and we'll go
Yeah.
for it.
Yeah. So kind of the spiel that I like to give is that our body is a container, right?
Mhm.
We have air on top in our lungs and in our rib cage. Then we have a diaphragm that separates our air from our guts. Then we have our guts, and then we have our pelvic floor, right? And as air moves through our container, the shape of our container should change, and the pressures inside should also change. So as you inhale and you inflate your container, your rib cage should expand in all directions to accommodate that added air. Your diaphragm should drop to make more space for air. And in doing so, your guts should bulge out to the front and down to the bottom a little. So on an inhale, you should feel your perineum, your pelvic floor, kind of that space between the vaginal opening and the rectum, and the anus drop slightly in response
Hmm.
to the fact that air has been added to the system. Okay. On the flip side, when you go to let the air out and exhale, what you're going to feel is your rib cage shrinks. Your diaphragm actually lifts up, kind of following the air out of your body. That creates a little vacuum that pulls your guts up and in, as well as your pelvic floor. So we like to get gals kind of rocking and rolling with that breathing rhythm where on the inhale, inflate, notice the pressure and the expansion. And then on the exhale, think about gently lifting two beans, right? So think about squeezing around and pulling up and in at the vaginal opening, as well as at the anus. And you want to include both the front and the back openings because the pelvic floor muscles sling around both of
Okay.
those areas. Okay, so you inhale, inflate, feel things descend, and then you exhale, lift, gently squeeze, and notice that there's a lifting action that happens.
Wow, that's incredible. I don't think I've ever thought that process through. And it's a good
Mhm.
reminder of really that deep belly breath versus the short inhalations that myself, I'll speak for myself,
Right.
to have a tendency to do more often,
Right.
where that is such a valuable benefit. And I have never heard of that comparison before. So that was really helpful to take that time to really think about where is my pelvic floor? Where are those muscles and what are they doing?
Yeah. Yeah. I tend to also see a lot in the clinic where women have become what we call paradoxical or exactly the opposite because in their brains, they want to lift up when they're inhaling
Mm.
because they want in all to go together.
Yeah.
Uh, and in doing so, they actually manipulate both the diaphragm and the pelvic floor to be coordinated exactly opposite of what we want. And it's this constant then tug of war. And the pelvic floor just kind of freaks out and quits, either by shutting off and allowing leaks or by spasming and tightening up to try to prevent them. That dysfunction kind of shows up.
Oh, interesting. Yeah, so kind of the extremes that
Mhm.
we have for our overachievers out there that may have
Yeah.
been doing too much or too hard for
Right.
years over time.
Right.
Great. Well, and
Yeah.
it sounds like there's opportunities for both sides. There's prevention. So if women are in perimenopause or even premenopause, which I'll admit I'm premenopause, I'm
Mhm.
36 years old, still menstruating regularly, but so much of this is important for preparing. So I'm thinking a
Right.
lot about like, I know probably in the next 10 years, there's going to be some changes. And
Yeah.
so would you say that doing these types of exercises, being aware of the pelvic floor, even before menopause or definitely perimenopause is beneficial for women's health?
Definitely. I think across the whole lifespan, I think this is one of those muscle groups that we just kind of take for granted. You
Mhm,
until there's a problem with it, it's
mhm.
off our radar. And then I think there's a little bit of attention postpartum, and then it's
Okay.
like unless it's causing a major problem, it just loses focus. But it's a muscle. It's a muscle
Mhm.
group. Use it or lose it, right? So I think by having a mindful, focused approach on including the pelvic floor in your regular exercise routine, you can definitely help counteract some of the loss of muscle health and function from that reduction in estrogen. So I usually try to get women to the point of, you know, if you're following a good exercise program and doing a mix of, you know, strengthening and conditioning, if you are breathing correctly and including your pelvic floor during the tasks that you're doing, those count as your daily pelvic floor exercises. You know, not everyone necessarily has to sit and do 3 minutes of Kegels,
Mm-hmm.
driving Kegels, you know, all of the
Yeah.
things that oftentimes, you know, are led to believe is necessary. But if you can weave it into your day, all the better. And then
Mm-hmm.
you're also gaining the functional benefit of your body learning and knowing how to use your pelvic floor to give you stability when you pick up your grandchild or push the door open or all of those things.
That's great to know. It's great to know that it doesn't have to be a separate thing, because a lot of the women I work with, they're already dealing with a lot, and
Mhm.
so adding one more thing, like now you have to do Kegel exercise, even if it is just 3 minutes, can really
Yeah,
be another straw that breaks the camel's back. So that's helpful to know that recommending just breathing appropriately, which has benefits in so many other areas too,
right.
can help them to target that and just bringing mindfulness and focus to that.
Yeah. Now,
So
don't get me wrong, you know, if you're in pelvic PT, you'll be spending some
yes.
time doing those specific exercises, but
Hmm.
like I said, I like to get gals to that point where it's just integrated in your day because then it actually happens. Then it's not something you have to remember to do.
Yeah, exactly. Well, let's talk about that. That's a great point as well. And this is helpful for me. But if our listeners are listening to this, maybe thinking, should I see a physical therapist for this, or can I just focus on breathing and be okay? Where's the line where it's like, you know what, having someone that's watching you, giving you instruction, where you have an appointment that you're going to and potentially could provide additional therapy? Where's the line, or how do women decide that?
Um, so that's a little tricky, right? I'm a
Okay.
pelvic PT, so I think everyone should come see a
All
pelvic
right.
PT.
You can say that. Yeah. We'll
Yeah,
support pelvic
I
physical
think
therapists out there.
yeah, I think that, you know, knowing that so many women are doing something just so subtly wrong that can
Hmm.
really make or break their success, that, you know, even just a single consultation with a pelvic PT
Hmm.
can be so tremendously valuable to make sure that you aren't making matters worse, right?
Okay.
So, um, you know, I see women every single day where they're, you know, maybe doing a sneaky breath hold in their Kegel,
Hmm.
and then they wonder why they are still leaking when they even try to do a Kegel, you know, as they sneeze. It's like, well, you're actually holding your breath, which is pushing down, and your pelvic floor can't combat the forces there. So,
Okay.
so I think having another set of eyes to give that feedback is just, you know, priceless.
Okay.
Um, I think that, um, it, you know, pelvic PTs are gaining accessibility. For a long time,
Hmm.
you know, we were kind of far and few between, but I do feel like, you know, there are some good resources out there for people to find pelvic PTs.
Hmm.
You know, like our national organization, the American Physical Therapy Association, has a website like Find a PT. You can put in women's health and pelvic PT, put in your zip code or city, and it can help you locate someone who has good training and resources as close as possible.
Oh, excellent. Thank you for that resource, because I
Yeah.
think that's helpful with us working with women all over the country, how
Yeah.
they know, okay, if I'm looking for a physical therapist that specializes in this, how do I find them? And that's also a great point. Knowing to ask, it sounds like they shouldn't just go to any PT clinic and say, I need physical therapy. They should be
Right.
saying, I want to work with a physical therapist that has expertise in pelvic health. Is that
Right.
correct?
Yes.
Okay.
Yeah. Yeah. You know, we do get exposure in our professional training, but like I mentioned, the vast majority is in kind of that postgraduate continuing education work.
Okay.
So,
And could you talk a little bit about that? What have you done to become an expert in this area? What that additional
yeah.
training looks like? So, helps our
Mhm.
listeners to understand, and also to make sure that they aren't going to someone that perhaps doesn't have that expertise and could
Right.
potentially do more harm.
Yeah. So there are various groups that offer continuing
Hmm.
education. Most of them provide 2 to 3 day courses on the weekend where PTs will attend, and it is learning both the kind of didactic information and in-depth learning of anatomy, physiology, what's normal, what's abnormal, what's common, what's uncommon. Um, and combined with extensive lab practice where these physical therapists are practicing on each other, so we're learning as a patient. Someone is doing these exams or these techniques on another PT, so that you have that experience and that kind of level of understanding, to know what the person on the table is also going through as you're providing the services.
Hmm.
And typically it is then a sequence of courses that most people will end up going through depending upon their interests. If they have more interest in bowel function or dysfunction, pregnancy, postpartum care,
Hmm.
pelvic health, but in even the introductory classes, the therapists are going to be exposed to treating urinary incontinence, bowel incontinence, pelvic pain,
Hmm.
painful intercourse, all of the things that we tend to see women in the clinic for.
Okay. Yeah. So, and it sounds like there might be specific approaches for each of those things. So it's not
Right,
just a blanket approach for the pelvic health. It's what
right,
is your specific concern, and here's the approach for you.
definitely,
Awesome.
definitely, yeah,
Yeah.
yeah. I was going
And
to circle back
yeah.
to what you were saying about knowing if you need a pelvic PT with your
Uh-huh.
last question. And as I was listing those things off, I think that's kind of a nice way to put it on the radar is if you're leaking anything
Hmm.
out
Yeah.
of your vagina or your anus involuntarily, that's not normal and that's not okay.
Okay.
It may be common,
Hmm.
and it may be brushed off because of whatever reason your mom or grandma may have told you,
Uh-huh.
but absolutely there are things that can be done about it that are conservative and
Hmm.
quite effective. If you're having any pain, painful gynecological exams, painful wiping, with bowel movements or after urinating, any kind of painful vaginal penetration for intercourse, um, that should not hurt. And
Yeah.
those are also indications that finding a PT, as well as working with your other medical providers,
Mhm.
but definitely things that pelvic PTs treat. Um, I think are good to have on the radar and seek more help. So
Yeah, absolutely. And I appreciate you listing out those symptoms because you make a good point. A lot of times, and I see this in a lot our Facebook group, and when women are talking with each other, they have great community support. But sometimes when everyone in the community is experiencing pain and incontinence, they
yeah,
normalize it.
right.
And while it may be, I don't want to say I hesitate to use the term normal, maybe common, like you said, during this time of life. Um, but it does deserve attention, and it doesn't have to be the normal. It isn't normal, and
Yeah,
really does deserve treatment, and there's treatments out there, and there's no shame in it. I think that's the other part. Sometimes women, when I'm talking with them, may feel a little hesitant to talk about things that are going on in that area, but it's important to know that's a really important part of health, and not to feel shame, and to know that they can get support.
most definitely. Yeah.
Yeah.
Yeah. Most of the women that I end up seeing and talking to in the clinic tell me, oh my gosh, I wish I would have known this 5, 10, 20 years ago.
Yeah.
It's again, I think it's gaining, it's ability to be talked about more comfortably, and knowledge is power. But
Yeah.
yeah, you're right. It still is something that for some reason women are felt to feel, some personal level of shame about, but should
Right.
not.
No, and that's what we're hoping here at Gennev to kind of change that perception of menopause, this time of life, and really provide the resources that are out there. And based on what you said, it sounds like most women, if not all, should have a pelvic floor PT on their healthcare team, or on their menopause support team during this time of their life. I mean, it's putting that
Yeah.
tool in the toolbox to really help them thrive.
Yes, most definitely.
Excellent. Well, I really appreciate your time today. Is there anything else that you want to add, or last tips or points? If you and give your clinic information and location for any listeners that may be near you, just
Yeah.
to finish up with.
Yeah. I mean, I think, thank you for having me. I think it's just awesome that we're getting the word out, and like I said, knowledge is power, and knowing that there's hope, and
Yeah.
that it doesn't mean that you have to jump on a medication. It doesn't mean you have to jump to surgery, and there's always the potential to make at least even slight improvements, and it's not terribly hard work to do.
Good.
Once you get committed to it, it's just a lot of changing and bringing things to awareness that can have pretty profound positive impacts on people's lives.
Great.
So I practice out of Orthopedic and Spine Therapy. We are a private practice in Wisconsin,
Okay.
in the Appleton, Wisconsin area, and we have clinics kind of scattered throughout the state, but pretty much focused in what we call like the Fox Valley area. So.
Okay. Excellent. Well, good information for our listeners to locate you, or certainly you gave them the information, and that was what was the organization? Is the American Physical Therapy Association?
Yep, APTA.
Okay, excellent. You can go on there, put in your zip code, and then specifically look up women's health and pelvic health to find
Mhm.
someone that is trained in that.
Yes.
All
Yep.
right. Well, just to finish up on my end, I do want to put a plug out there for our Health Fix program. I am a menopause coach, as I mentioned in the beginning, working with that program, and having that membership, it's a subscription-based membership. You get the opportunity to work with someone like myself, and talk with them out through calls, as well as have supportive accountability between those calls. And so it can be an opportunity as well if you're thinking, I don't know if I should go see a pelvic PT, even though I think after this we all should. But if you have questions about that, or just questions about any symptoms you're experiencing during menopause, signing up for the Health Fix program gives you the opportunity to have some of those questions answered, provide resources, information, and support around finding what the next steps are. Perhaps it's finding that physical therapist in your area, or perhaps it's just figuring out what that next step is for you, whether it be pelvic health or other menopause symptoms. So sign up for that Health Fix program, and I hope to be working with more of you that are listening to this podcast today. So thanks very much, Meagan, and
Thank
hope you have a
you.
great rest of your day, and I'm sure we'll
Likewise.
collaborate again soon.
Wonderful. I look forward to it.
All right, take care.
Thank you.